Hi, welcome back. This video will focus on pain and its effects on sleep. You may be wondering, why do I need to know about pain if I'm just trying to go to sleep? Well, the negative emotions and stress caused by pain make it hard for us to get relaxed enough to go to sleep. Also, pain can affect how comfortable we are, which can be responsible for our tossing and turning all night. Therefore, if we want to get a good grip on sleep, we should understand what types of pain there are, what causes it, and what we can do during our day to set ourselves up for success at night, which will all be covered within this video. Most of us know what pain is, and no, I don't mean the feeling that you feel when you miss your exit on the highway. What I mean is that pain is actually one of the most common reasons people seek medical attention. We feel pain when something bothersome triggers our body to send a response to our nerves, which then send it to the spinal cord and upward towards the brain. So sometimes this signal does provoke a reflex response, such as when we jerk our hand away from a hot pan. But pain can be divided into two categories. Acute pain is pretty common and it lasts less than 3 months, is a symptom with an identifiable cause, and it typically responds pretty well to treatment. We feel this type of pain following a surgery or whenever we break an arm or a hip. Chronic pain lasts more than 3 months, is a condition that may develop after an incident or we may not know why it's happening, and it typically persists beyond the expected time of healing. An example of this is arthritis and the pain that we may feel with flare ups. Pain is associated with less time spent asleep, greater delay in sleep onset, which we remember is how long it takes us to go to sleep, poor sleep efficiency, which is out of the total time that we're in bed, how much am I spending it sleeping, and more time awake after initially falling asleep. Physically, the discomfort that we feel when we are in pain increases our level of internal arousal, which really makes it hard for us to find that peaceful state that we need to go to bed. This really hampers our ability to get a good night's rest, and psychologically, the emotional responses to pain, pain related thought processes, and all that can cause poor associations with sleep and contribute to sleep disturbances. Referring back to our sleep stages, pain prolongs our N1 or our lightest sleep phase and encourages fragmented sleep and more awakenings due to movement related disruptions like tossing and turning. If pain is all you can think about while you're sleeping and prevents you from doing things during the day, I want you to pull out the pain wheel on chapter 2 of your workbook. Think of this wheel as your steering wheel towards the path that you want to be on. Within each of the wedges of the steering wheel, there are different strategies to help manage pain. The outside or green circle represents I'm doing this well already. The middle is this needs some improvement. And the red means I need a lot of improvement here. Put an X in the section of the wedge that matches how well you are practicing that strategy currently. And as you learn and implement these strategies, refill the circle every week so you can track progress. We want to do things during the day that control and minimize pain because it sets us up for success at night. If we've spent most of our 16 hours during the day doing things that make our pain worse, then yeah, we're going to have a poor 8 hours of sleep at night and we're not going to benefit from our actions. A good night's rest actually starts when you wake up in the morning, and by keeping these strategies in mind, you're ensuring that you get the rest that you deserve. So, our first strategy is to pace, not push. Pacing is when you, rather than your pain, is controlling how your day goes. It means that you're really in tune with your body, and whenever you're accomplishing tasks, you're working with intention. Ways that you can pace are breaking up tasks into smaller points rather than attempting to do it all at once. This can be the difference between completing one task quickly and being out of commission for the rest of the day versus completing several tasks over a window of time without feeling as exhausted. Feel free to take breaks as needed, and by doing so, you will prevent today's pain from bleeding into tomorrow's progress. You can also work at a slower, less intense pace and gradually increase the amount of time doing a specific task before needing a break in order to improve endurance and activity tolerance. For example, if my back really hurts and I'm trying to do dishes over a sink, I can maybe do it for 10 minutes one week as I'm getting better, and then the next week I can do it for 12 minutes before needing a break. You can also change tasks often and use different parts of the body throughout the day. For example, if vacuuming and you're having that back pain, you can alternate using each arm, both arms, walking with that vacuum, or pushing more with your legs for momentum. So it's not so much on your back. And this allows one part of your body to not yell at you while trying to sleep later. The second is to consume wisely. So it's important to have regular, healthy eating throughout the day because, first of all, it helps the medication be effective, it helps your healing, it helps you maintain energy, and then it also helps to manage constipation that you may feel from a lot of pain medications. It is also important to include lots of fiber in your diet, as many pain medications cause you to feel constipated. You should be including foods like fruits, veggies, nuts, seeds, and whole grains. Plenty of water is also needed to promote body processes, and adults are recommended to consume between 56 and 64 ounces of water per day. You should also eliminate tobacco and alcohol products as they interfere with the body's ability to manage pain and oftentimes they slow healing. Right now, we'll focus on foods that help promote sleep. So, things like kiwis, cherries, milk, fatty fish, and rice have been found to aid in sleep due to their melatonin concentrations. I have included an excerpt here that talks about how many of these items, but just for time's sake, I'll let you read these independently and kind of get and build some strategies from there. The next thing is because acid reflux is a really common issue that prevents individuals from falling asleep or sleeping comfortably through the night. Here's a list of foods that you want to avoid, and then we'll go over a list of foods that will be really beneficial. Foods that cause heartburn are fried food, fast food, pizza, potato chips, and processed snacks, chili powder and pepper, fatty meats such as sausage and bacon, cheese, tomato based sauces, citrus fruits, chocolate, peppermint, and carbonated beverages. And foods that are known to help are high fiber foods because they allow you to not overeat. These would be foods such as whole grains like oatmeal, couscous, and brown rice, root veggies such as sweet potatoes, carrots, and beets, and green veggies such as asparagus, broccoli, and green beans. And alkaline foods have also shown to be very helpful. These foods are helpful because they have a higher pH and can help offset strong stomach acid. Foods like banana, melons, cauliflower, fennel, and nuts should be incorporated in your diet. And then watery foods that help to dilute stomach acid. These foods are important because they dilute and weaken stomach acid. Foods like celery, cucumber, lettuce, watermelon, broth based soups, and herbal tea should be incorporated in your diet. Our third strategy is to manage medications. If you are taking pain medications or any type of medication in general, it is your responsibility to know what the medication does, potential effects or ways that it can interfere or work with your body, and then how and when to take them. So a helpful strategy that you can use here is to develop a medication plan. In this workbook, I have also provided one for you that you can spend time filling out if this is really an area that you struggle with. So whenever we're making that plan, we want to keep an updated file of all of the medications that we're taking, and that includes written instructions. The second is to use a pill box when appropriate, and that's going to have your dosage and the times of day that you should be taking these medications. Third, if you have a problem remembering and every day you just cannot seem to take this one specific medication or whatever it is, I suggest using a phone timer or alarm that's repeated in order to remind you. The next is depending on when the medication should be taken, you can also find it useful to link it to another activity that you do every day. So in the morning when I brush my teeth, I'm going to take this medication. Since our focus here is improving sleep quality, it is important to take note what medications that you're taking may have poor sleep as a side effect and to have an open conversation with your physician depending on what your priorities are for your health. The fourth strategy is to move and exercise. Not only is exercise good because you're mobilizing the body, it also allows you to prevent deconditioning through activities that require strength, endurance, and flexibility. According to the CDC, older adults need 150 minutes of moderate aerobic physical activity, such as brisk walking, per week. This could be 30 minutes per day, 5 days a week, and does not have to be very strenuous, but it is important to find some way to keep your body moving. Physical activity is also so important when it comes to promoting a good night's sleep because it affects the body's sleep wake cycles by controlling adenosine levels, which are in charge of making you feel drowsy. It also plays a role in affecting body temperature, which plays a role in sleep. Thinking back to our sleep stages again, research has shown that exercise produces modest increases in NREM stages 2 and 3, which are our deeper stages of sleep. It also reduces the amount of time it takes to get to REM sleep and to just fall asleep in general. So then the question arises, does it matter what type of exercise I am doing? Well, recent studies indicate that physical activity that is structured and goal oriented is most beneficial to older adults, as it works on both the body and mind. Lower intensity exercises such as yoga, Tai Chi, and aquatics have also improved self reported sleep quality, in addition to cognitive function. When thinking about how and when to implement adequate physical activity into your day, keep in mind that exercises should not be completed directly before bed. Instead, research has found that 4 to 8 hours prior to sleep is best. The fifth strategy is to shift gears and lighten up. So, areas of your brain that are very active during pain episodes can also quiet down whenever we're focusing on something else. This research is really important for us to consider because it suggests the idea that we do have control over our pain and our pain experiences. So, think about those times whenever you did have pain, but it kind of lessened because you were focusing on a work something you were doing with work, or you were reading a book, or just where that pain seemed to diminish just a little bit, and use that and those activities or what thought processes that you were doing to help you control your pain perceptions. So this means really positive things for us whenever we're thinking about our sleep, because it does mean that we have a solution to fixing our sleep if pain is really bothering us. Instead of focusing just on what our body is physically feeling, we can redirect our minds and limit those pain signals in our brain by listening to music maybe while we're trying to go to sleep, or redirecting our thoughts to more positive events that happen during the day. This is also a good area where you can implement some of the relaxation strategies that we will go over later on in this webinar. The sixth strategy is to improve sleep. So, sleep is very important in dealing with your pain. Sleep disturbances can also develop from strategies used to cope with pain. So, resting in bed too much, sleeping late, or napping throughout the day can really mess up your schedule. Suggestions include to set your bedroom aside as a special place that your mind will associate with sleep. Do activities like watching TV or studying in a different room, and think of ways to make your bedroom a peaceful place through colors, textures, smells, and lighting. Consider changing eating habits that may interfere with your sleep, and eat larger meals earlier in the day, and reduce or avoid caffeine, especially within a few hours before bedtime. Alcohol can also interfere with getting a deep sleep. Slow down before you lie down and take a warm bath or shower before going to bed. Perform peaceful pre bedtime rituals or engage in calming activities such as reading, praying, or listening to music. And try to get appropriate exposure to natural light during the day, especially in the morning, in order to reset your internal clock for sleep and wakefulness. This will help you to be able to sleep through the night and to avoid waking up so many times throughout your night, which can lead to poor sleep quality. Seven is participate. Many times, whenever we're in pain, we kind of pull away from activities because they're too painful. They take too much from us. They're just not in our books right now. And this is something that you want to try to avoid because um, pulling away from these activities can cause some isolation and loneliness, which is known to exacerbate the pain symptoms. So, things that you can do is make a conscious plan of how you're going to do an activity, and write ways of how you're going to get there and set a goal for yourself. And you can also have somebody come with you and have them as your accountability partner, because research shows that the amount of time you spend positive social experiences is actually going to decrease pain's effect on your sleep at night. Lastly, is to use good ergonomics. So, using good ergonomics means designing tasks, tools, furniture, and equipment in a way that minimizes the risk of injury on your body and improves overall efficiency. Think about some of the tasks and activities that you are doing and think if there are ways to modify them to put less stress on your body or whatever area is causing you pain. Positioning your environment is also important to have less impact on your body. So, to use your environment as an asset to you. So, for example, if I have really bad shoulder pain, I'm not going to put all my mugs, all my plates, everything that I use day to day way overhead because that's just going to further hurt my shoulder. Instead, I'm going to maybe set up a cute display for my mugs on my counter or um, put some of those things that I use very frequently lower down so that way I'm not further hurting myself every day. Another thing that you can do is to use more parts of your body whenever you're doing activities, and making sure you're having good posture alignment, not lifting so much with your back. Just different strategies like that depending on where your pain is at. Another thing you could do is using a rolling laundry basket, instead of one that you have to pick up and carry back and forth, and setting up a desk workspace that is nice to your neck, back, and shoulders. So we have discussed information about pain, how it affects your sleep, and strategies you can use to overcome it. So take some time to review the strategies, and this is not an all or nothing thing. Pick one or two for this week that you want to incorporate that suit what you're going through, and use that strategy and your pain will to monitor your progress as weeks go on. And once you feel comfortable, you can start incorporating more things to help you reach better sleep. Thank you. We'll see you next video.